Let's cross now to the Maritime Union of Australia. I'm joined by Dean Summers in Sydney. Thanks for joining us, Dean. I'm pretty keen to get your thoughts on the Ruby Princess. This has been an absolute shambles, the way that this cruise ship has been handled. It's led to at least a dozen deaths from its passengers and obviously well over 100 infections going out into the community. But now it's docked at Port Kembla for supplies and for medical treatment. Do you have any concerns about those docking arrangements?
Well, g'day, Chris, and thanks for having me on the show. We sure do. The problem is that we've got up to 50 different nationalities of seafarers. We call them seafarers because their crew, staff, everybody on that ship under the Maritime Labour Convention is a seafarer. 1,100 on that ship, and they don't know what's going on. We know that there's been a debacle about Carnival and who said what, who did what. The New South Wales government are up to it into their neck, and we don't know what's going on either. But what is sure is that that crew is being treated as just a bit of an added problem inside a pandemic. We know that there are a number of cases on board. The ship has been hanging off Sydney for a very long time. It's now a crime scene, and I understand it's going to be the centre of a criminal investigation, a homicide investigation. What has to happen is that crew needs to be brought ashore in Sydney, and the problem needs to be dealt with, not shuffled off to a grain terminal in Port Kembla.
Well, this is the issue. As you say, there's over 1,000 people on the ship, a crew of various kind. We know that at least 200 of them are suffering symptoms that could be symptomatic of coronavirus. Well over a dozen have actually tested positive to the virus. What is the best option? Are you saying to get them all off the ship for quarantining or isolation, or only those who are ill, or should they be treated on the ship? It is a difficult issue. What is your suggestion? What are you pushing for, presuming, of course, that these are not even your union members?
Oh, well, they're not the Maritime Union members, but they're members of the International Transport Workers Federation, and that's who I primarily represent. So they are represented by us, and if it's not us, there's nobody else in the world that will stand up for these workers. The ship is flagged in what we call a flag of convenience country, and so that country offers no support for these workers. So,
which country is that?
Bahamas, I understand, in this instance, but they're flags of convenience. Bahamas, Malta, Panama, Monrovia, all the same ilk. So we are the International Transport Workers Federation. We will represent these workers and all of the other workers stranded around Australia on cruise ships. We wrote to the Prime Minister late last week, and we asked him to get in front of this situation and to manage the situation on a humanitarian ground. So this is not political, this is not industrial, this is purely humanitarian. And here we are, 3 or 4 days later, nothing's happened other than the problem's been hidden down in Port Kembla. We think that there is the world's best cruise ship terminal available, empty, left wide open in Sydney. It's the International Cruise Ship Terminal, and that's the appropriate place for this ship to be tied up to and for the crew to be treated. Bearing in mind, when you're in Sydney, you're surrounded by 3 major hospitals. Very close, the terminal has all these access arrangements put in place. They're a maritime security-related zone, so they can be secured extremely easily.
Dean, sorry if I could interrupt, because I think you've got a very strong point here. I think you can understand the community and governments are going to be very worried about this. The state government clearly has completely stuffed up the disembarking of the passengers from the Ruby Princess. That has caused a massive public health problem across the country. Imagine how good our national figures would look without the Ruby Princess having been disembarked in that way. But I think you're dead right. These 1,000 crew members, they're not Australians, but Australia sort of has care and a duty of care here, and we've got to manage this very well. But I think a lot of people would be very worried about our hospitals being overwhelmed, or the middle of Sydney overwhelmed with 1,000 cases. Is there not a sensible way that people could be isolated and transported home, either on that vessel or through airlines and the like? Is there any practical way to resolve this situation rather than just leave everybody on this ship for an interminable time?
You're exactly right. It didn't work in Japan. It's not going to work in Sydney. And our remedy and our suggestion is that we bring the ship alongside, we get a handle on the size of the problem. Those people that just need to be isolated, let's isolate them. Sydney's full of empty hotels. Those people that need medical care are still going to need the medical care in our hospitals one way or another, but let's identify who they are, how they can be treated and accommodated, and deal with that problem. And then the government can get into the logistics of flying these people home on chartered vessels, and the company has already accepted that they will pay the bills. So it's at no cost to the Australian taxpayer. It's simply going to call for some forward thinking, some lateral thinking on a humanitarian ground.
Dean, thanks so much for joining us.